In this video, I'm going to explain everything you need to know about furosemide, especially what it does to the body and about specific side effects. This is especially important if you're about to start furosemide or you're already established on it. I'm also going to answer some frequently asked questions in my clinics. Why does it make me pee so much? How long does it take to work? What's the best time of day to take it? And what are the other types of diuretic? So let's start at the beginning with what is furosemide. It's a type of medicine called a diuretic, and these are sometimes called water tablets because they make you pee more. This helps get rid of extra fluid in your body. It's used to treat high blood pressure, heart failure, and a buildup of fluid in the body called edema. It's also sometimes used to help you pee when your kidneys are not working properly. So how does it work? Furosemide is specifically a type of medicine called a loop diuretic. A loop diuretic works on a specific part of the kidney called the loop of Onlay to increase the salt and water you pee out, and so makes your body get rid of extra fluid through your kidneys. This means you have less fluid in your tissues, which helps get rid of swelling called edema. You will also have less fluid in your blood, which helps reduce blood pressure. So how long does it take to work? Furosemide starts to work within 1 hour, but it may take a few weeks to fully take effect. So how long does it work for? A dose of furosemide works for about 6 hours. So who may not be able to take it? Furosemide is not suitable for everyone. To make sure it's safe for you, tell your doctor if you have ever had an allergic reaction to it or any other medicine. If you have low blood pressure, if you have signs of dehydration such as being thirsty, having a dry mouth and dark pee, if you have liver disease, diabetes, any difficulty peeing, or Addison's disease, which is a rare disorder of the adrenal glands, or gout. And tell your doctor that you are taking furosemide if you're going to have a glucose test, or a test such as an X-ray or scan that involves using a dye containing iodine being injected into your blood, or if you are going to have a major operation or a general anesthetic to put you to sleep. So what's the dose? Now, the usual dose to treat adults with high blood pressure is 40 to 80 milligrams a day. And for heart failure or edema, it's 20 milligrams to 120 milligrams a day. Doses are usually lower for people over 65 years old, as they may be more prone to side effects. And furosemide comes as tablets, liquid and injection, but this is usually only done in hospital. So how do you take it? It doesn't usually upset your stomach, so you can take it with or without food. And you'll usually take it once a day in the morning. Sometimes take it twice a day, once in the morning and again at lunchtime, and occasionally you take it every other day. You don't need to take it at the same time every day, but you can occasionally take it at a different time if it's more convenient for you. For example, if you need to go out for a few hours in the morning and you won't be near a toilet. So try not to take furosemide too late in the day, especially after 4 o'clock in the afternoon or at night, otherwise you may have to wake up to go to the toilet. So what if you get ill while taking it? Now contact your doctor if you have a high temperature, if you're sweating and shaking, or you're being sick or vomiting, or if you have severe diarrhea. Your doctor may recommend you stop taking furosemide for 1 to 2 days until you are feeling better. You can start taking it again when you're eating and drinking normally. Now, if you take furosemide when you have an illness that makes you dehydrated, it can make your dehydration worse. So what are the common side effects? Peeing more than normal, feeling thirsty, a dry mouth, headaches, feeling confused or dizzy, or feeling or being sick. And furosemide may increase your blood sugar levels and cause changes to the levels of certain minerals in your body called electrolytes. For example, it may cause low potassium levels, low sodium levels, low magnesium levels, low calcium levels, and low chloride levels, or high glucose levels. These changes can be serious, and your healthcare provider will do regular blood tests to check your glucose and electrolyte levels to make sure they are properly balanced. So what are the serious side effects? Tell your doctor if you get unexplained bruising or bleeding, a high temperature, sore throat, and mouth ulcers. These could be signs of a blood disorder. If you have severe stomach pain, which could reach through to your back, this could be a sign of an inflamed pancreas. If you have severe pain in your side or blood in your urine, these could be signs of inflamed kidneys. If you have ringing in your ears or loss of hearing, or if you have a serious allergic reaction to furosemide. These are not all the side effects. For a full list, see the leaflet inside your medicines packet. So what are the cautions with other medicines? Some medicines can affect the way furosemide works. These can stop it working properly or increase the chances of you having side effects. Tell your doctor if you're taking medicines to treat or which have the side effect of an irregular heartbeat, including amiodarone, digoxin, disopyramide, flecainide, or sotalol. Medicines that can change the level of potassium in your blood, such as potassium supplements, steroids, or other diuretics. Medicines used to treat mental health problems, such as amisulpride, lithium, pimozide, or risperidone. Painkillers known as non-steroidal anti-inflammatory drugs, including diclofenac, ibuprofen, or naproxen. Medicines that treat high blood pressure or those that have a side effect of low blood pressure. A medicine used to treat ulcers called sucralfate. Leave about 2 hours between the time you take furosemide and sucralfate. And if you're taking furosemide with painkillers and remedies, some of these medicines contain a lot of sodium, which is found in salt. Too much salt can stop furosemide working properly. So medicines that contain a lot of salt include soluble paracetamol, soluble cocodamol, and some remedies for heartburn and indigestion. And finally, tell your doctor if you're taking any potassium supplements. These change the levels of potassium in your blood and can affect the way furosemide works. So let's answer a couple more questions asked in my clinic. What are the other types of diuretic? There are other diuretics that work in a similar way to furosemide, and there are 3 different types. Each type works on different parts of the kidney. The first one is loop diuretics, such as furosemide that we've just talked about, and these include bumetanide and furosemide. Can also be used to treat heart failure. Furosemide can also be used to treat high blood pressure. The second one is thiazide diuretics, such as bendroflumetazide and indapamide. These are used in low doses to treat high blood pressure and in higher doses to treat heart failure. And the third one is potassium-sparing diuretics, such as spironolactone and eplerenone. These can be used to treat heart failure. These can also be used if you lose too much potassium with other diuretics. So how much fluid should I drink while I'm taking furosemide? It's usually best to drink normally while you're taking it. A good rule is to drink enough fluid so you're not thirsty for long periods, and to steadily increase your fluid intake when exercising and during hot weather. Passing pale, clear pee is a good sign that you're drinking enough. However, if you have heart failure or kidney problems, you might need to limit how much fluid you drink. Your healthcare provider will tell you exactly how much you need to drink each day. So can I take furosemide to lose weight? Now, if you're taking it for high blood pressure or edema, you may lose a bit of weight as your body loses water, but don't take furosemide specifically to lose weight. I hope this video helped you understand how furosemide works, why it makes you pee so much, and what side effects to watch out for, and how to take it safely. Now remember, it's a powerful medication, but it's really effective when used properly and with your healthcare provider's guidance. Now, if you found this video helpful, please give it a thumbs up and consider subscribing for more straightforward medicine information. And if you've got any questions or experiences with furosemide you'd like to share, please drop them in the comments below. Thank you for watching, and I'll see you in the next video.